there, I'm Ashley. I'm the student nurse practitioner taking care of you today. What brought you in today?
I'm gonna check it.
Okay, just your yearly physical?
Mm-hmm.
Do you have any concerns or complaints you want to discuss with me today? Okay. How old are you?
41.
Okay. Well, I'm going to shut the door and allow for privacy. I'm going to come over here and wash my hands before I get started. Alright, so I'm going to start with your hands. Just going to take a look at your fingernails. No clubbing of the nails is noted. Capillary refill is less than 3 seconds. Skin turgor is less than 3 seconds on the back of the hand. Skin is warm and dry with no lesions noted. Going to palpate the radial artery. Radial pulse is 2 plus and equal bilaterally. Brachial pulse is 2 plus and equal bilaterally. Now you squeeze my hands. Grip strength is strong and equal bilaterally. You have full range of motion. Leave your fist, open up. Okay, range of motion in your wrists. Up and down with your elbows. All the way around with your arms. Any problems with your range of motion? Full range of motion noted to fingers, hands, wrists, elbows, and shoulders. Biceps reflex is 2 plus bilaterally. Triceps reflex is 2 plus bilaterally. Can you touch my finger? I touch your nose, and my finger, and your nose, my finger, your nose, finger, and your nose. Let's try the other side. Finger, your nose, finger, your nose, finger, your nose, finger, your nose. I'm going to palpate any axillary lymph nodes. You have any pain or tenderness? Okay. No lymph nodes palpated in the axilla, or no pain and tenderness either. I'm going to wash my hands one more time. Now I'm going to take a look at your scalp. Do you have any pain or tenderness when I do this? Head is normal cephalic. There is a scar from the right frontal over to the top of the right ear. No crevices or lumps noted. You have any pain? Sinuses are palpated with no pain. Feel that?
Mm-hmm.
Feel this?
Mm-hmm.
Feel this? Open your mouth. Shut your jaw. Facial sensation noted. Cranial nerve 5 is intact. And no clicks with the TMJ joint. So if you can look at the wall, I'm going to test your corneal light reflex. Corneal light reflex is normal, no sign of deviation in the eyes. And just keep looking at the wall, please. Pupils are equal and refractive to light. Now I'm going to take a look at your eyes. Red reflex is noted. Retina and vessels are intact and optic disc is visualized. Let me go to the other side. Are you ready?
Mm-hmm.
Red reflex is noted. Optic nerve is visualized and retina and vessels are intact. Can you nerves 3, 4, and 6 are intact. I'm going to whisper a number in your ear. You just let me know what you hear, okay? 21 is correct. 14 is correct. Gross hearing normal. Cranial nerve 8 is intact. Do you hear this the same in each ear, or better on the left, better on the right? Weber test is positive for normal hearing in both ears equally. And take a look at your ears. Auditory canal is intact. Tympanic membrane is intact and pearly gray. Auditory canal with no deviation and clear. Auditory canal with no deviation and clear. Tympanic membrane intact and pearly gray. I'm going to take a look at your nose. You look up. Nares are patent, no septal deviation noted. Sir, do you have any change in your sense of smell? Cranial nerve 1 is intact. Can you smile? Teeth and gums are intact. Open your mouth. Tongue rests on the base of the mouth. Cranial nerve 9 intact. Stick out your tongue. Tongue protrudes with no deviation. Cranial nerve 9 intact. And can you stick out your tongue and say, ah? Again. Tonsils are 2+ and visualized. Uvula rises with no deviation. Cranial nerve 11 is intact. No pain or tenderness upon palpation of the neck. No lumps present. Trachea is midline. No goiter. Unable to palpate the thyroid. Sir, can you shrug against my shoulder? Thank you. Cranial nerve 11 is intact. Carotid pulse is 2+ and bilaterally and equal. No carotid bruise heard. Chest is equal. I'm going to set these down here. Chest is equal. Breathing is non-labored. Anterior posterior diameter is normal. I'm going to test chest expansion. Can you take a deep breath? Chest expansion is equal bilaterally. Percussion sounds resonant with no pain upon percussion. Costovertebral angle assessed with no pain upon palpation. Take a deep breath. And again, sir. Raise your arm. And a deep breath. And a deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Lung sounds are clear and equal bilaterally. No sign of wheezing. Can you turn around, please, and lay down? I'm going to palpate the precordium. And auscultate for cardiac sounds. Apical area. Pulmonic area. Erb's point. Tricuspid area. And mitral area. I'm going to auscultate with the bell for any murmurs or bruise. Apical area. Pulmonic area. Erb's point. Tricuspid area. Mitral area. Apical pulse, regular and rate and rhythm. S1 and S2 heard, no S3, no S4 murmurs or bruise noted. So I'm going to pull your shirt up to look at your stomach. Abdomen is symmetrical. Going to auscultate for vowel sounds. Going to auscultate for bruise in the abdominal aorta and the renal arteries. Vowel sounds are normal active, no aortic bruit or renal artery bruise. Do you have any pain or tenderness? No pain or tenderness upon percussion. Just going to palpate. You let me know if you hurt. No masses or pain or tenderness felt on palpation. I'm going to palpate the liver. Liver palpated with good borders. And I'm going to palpate the spleen. So if you'll take a deep breath and breathe out. Unable to palpate the spleen. Sir, if you'll just lift your head off the bed. No sign of pain or hernia with lifting the head. Thank you. Extremities are symmetrical. I'm going to test pulses. Dorsus pedialis pulses are 2+ and regular bilaterally. Posterior tibialis pulses are 2+ and regular bilaterally. Sir, can you push up against my hands? Push up and down, pull back, and push me out. Thank you. You're going to feel me bend your knee and come up at your hip, just testing range of motion. Any pain? Okay. And I'm going to do the same with this leg. Any pain? Full range of motion noted to feet, ankles, knees, and hips. I'll have you go ahead and sit back up and swing back around. Patellar reflexes are 2+ bilaterally. Achilles reflexes are 2+ bilaterally. Babinski reflex is negative bilaterally. Okay, I'm going to help you down. And I need you to walk to that counter, please. Just normal walk. Gait is steady, no sense of falling. Come towards me. So when you go back, I need you to go heel to toe. Tandem walk is normal. And come back on your tiptoes. Toe walk is without problems. And back on your heels. Okay? And heel walk is without problems. Okay? Can can you put your hands out straight in front of you and shut your eyes? No drift of the hands, no drift of the body. Okay, thank you. Romberg sign is negative. All right, and I'm just going to take a look at your spine. Spine is symmetrical. Can you bend over, touch your toes? And how about lean back at the spine? And then side to side with your hips. Full range of motion of the spine is intact. All right, thank you, sir.